on select Bullfrog spas. Don't let this limited time offer slip away. Visit Wet Pools and Spas on Rickleman Avenue in Effingham or call 217-347-3450 to create your escape today. It's 12:30 on a not a bad day. Kind of pales in comparison to yesterday in the 60 degrees, but we do what we can, Brian, right?
We're in good shape, and it's time for Mythbusters.
That's right. And there's this redheaded girl on Mythbusters back in the day. Were you that girl?
I don't think so.
Oh, could have been.
Maybe.
Dr. April Ritz in the house. We're going to bust myths about
That's right.
pelvic floor health, I do believe.
Yes, you got it.
Oh,
You guys should already know the first myth.
Which one's that? Yes, I've heard this one.
I have heard this.
Yes,
Here.
but not okay. So, Dr. April here with Effingham Pelvic Health and Wellness.
Yep.
Myth number one, which is the thing that people still do not understand, is that not every. So the myth is that everybody should be doing Kegels for any pelvic floor health issues. And that is simply not true. We still have people, though, when we do vendor events and things like that, they're like, well, I've been doing my Kegels. Why isn't my stuff getting better? I'm like, well, what's your symptoms? I'm like, based on those symptoms, you should not be strengthening your pelvic floor. So many people have tight or overactive pelvic floors, and Kegels can actually make their symptoms worse. So if you have a pelvic pain condition or like endometriosis or interstitial cystitis, pelvic floor therapy helps with all of those. But what you will not be receiving from us is Kegels to do at home. So myth number one, stop doing your Kegels. Stop doing your Kegels if you're having any pelvic pain or tension issues.
Okay.
So I always explain to people, actually had a patient came in yesterday and pelvic floor is doing great. She's like, can we actually work on my shoulder? And I was like, we definitely can. And she's like, I've been doing weights at the gym overhead, but my shoulder, just like when I move my arm, it hurts. And I'm like, okay, we need to stop doing weights. So in therapy, what we learn is if there's pain, we got to work on range of motion first and getting the shoulder or whatever it may be, the pelvic floor, to work through the full range of motion without pain. Once you're pain-free with that range of motion, then we can add weights and start doing some strengthening exercises. So it's the same thing with the pelvic floor. If your shoulder is tight and painful, I'm not going to tell you start lifting weights. We're going to work on range of motion first.
Okay.
Same thing with the pelvic floor. A lot of people's pelvic floors are tight and can be painful, and so I'm not going to tell you you need to start strength training, which is what Kegels are.
Okay.
So
that makes sense.
That's a good comparison.
Yes.
All right. I like one of the favorites, myth number 2, busted.
Peeing when you sneeze, laugh, or jump is normal.
You wouldn't think it would be normal.
It is
I
not.
mean, I wouldn't
I'm
think.
glad it's not normal.
But the number of women that come in and say, yeah, I'm not having any leakage issues. I'm like, okay, so with sneezing, coughing, you're good. Or if you go to the trampoline park with your kids, oh, well, yeah, no, I can't do that.
Yeah,
okay.
That's impossible.
Exception.
So leaking is common, but it is not normal at any age, okay? The only time leaking can be a little bit normal is like the first 6 weeks after having a baby. A little bit of leakage can be common then, okay?
All
Yeah.
right.
So yeah, leaking is just a sign that your body needs more help, your pelvic floor needs more support, and it's a time to reach out. And it's with any pelvic floor issues or back pain or hip pain issues, it's always best to address it right away before the condition continues to get worse.
And back to number one, you're probably not going to say, don't just start doing Kegels to help that.
Correct. I actually had a patient this morning that was like, so what do I need to do for, because her other issues are doing better. She's like, what do I need to do for the leakage with sneezing? And she's like, I haven't had any leakage in a long time, but am I good now? Do I need to be doing anything else? And I'm like, we got to continue to work on making sure there's no tension first. And then we can add in strengthening.
Okay, very good.
All right.
Just follow the doctor's orders, in other words.
Yes, just listen to what we say.
I like that.
All right. What is number 3?
Myth number 3 is that sexual activity or sex just gets worse as you get older. Okay. And the truth is there is more things that play a role as we get older. Okay. We can have more like dryness issues. Men can have more issues as well, or loss of pleasure for men and women. But that does not have to be the case. We have a lot of patients that we work with these issues that are able to get back full function and be pleasurable and be great. So if you're getting older and this is an issue for you, reach out to our clinic and we can help you with it. It doesn't have to get worse as you get older.
Okay.
Men and women.
Men and women. Yes, we help with both.
All right, very good, All right, we're rolling. We're on number 4, another myth to be busted.
Yes. So myth number 4 is that pelvic floor issues only happen after having babies. Okay.
Oh,
Oh.
Not true. So we see
Mm.
pelvic floor issues in toddlers.
Yeah.
We see it in teenagers. We see it in athletes, men, post-surgical patients, such as like post-hysterectomy
mhm.
or prolapse repair, or even major abdominal surgeries where your abdomen's been cut. You have a significant scar can play a role in pelvic floor dysfunction.
Yeah, you wonder, that's really not part of your pelvic floor, really, up there about halfway up your stomach or whatever. But it is. It's all connected.
Yes, because your diaphragm and your pelvic floor work together.
Aha.
So I'm actually working with a patient who just had recent like breast reduction and significant scarring all throughout her chest.
Ooh.
Significant shoulder range of motion, diaphragm doesn't open. So we're working on scar release and all of that too. So I always tell people, yes, we are a pelvic floor clinic, but there's so much more that plays a role into the pelvic floor than just the pelvic floor muscles themselves.
Connections.
Yes.
All right. How about that? The fifth one. We're halfway there, as Bon Jovi says.
Fifth one is pain is just part of being a woman. You know, you have your periods, pains are going to be expected with those. So, or like you have a gynecological exam and pain is just expected to happen with that, and you dread having that pap smear appointment.
Ugh.
Not the case.
Hmm.
You should not have period pain that impacts you from going to school or to work or to activities. A little bit of cramping can be normal, but it should not be impacting your daily life.
Gotcha.
And we help with, it's called dysmenorrhea. So period pain, we can significantly improve that pain so you can function normally. And women should never have pain with pap smears or with tampons. So if there's any pain with any of those issues, reach out to us. We can help. It's not normal. You don't have to live with that.
Something going on, so check it out.
Absolutely.
Yeah.
What's that number 6 one? Man, you believe it? We're flying through these.
We're
this
flying
week?
through them.
Hey,
Yep.
gotta do it.
Myth number 6 is that if you've had a C-section, you don't need pelvic rehab. Or if I have a repeat C-section, it's going to save me from any pelvic floor dysfunction or issues.
Ooh.
Not true.
Aha.
All women postpartum need to be seen for a minimum of 3 visits. And the thing with C-sections are it increases your risk. It's a major abdominal surgery.
Yeah.
It increases your risk for diastasis rectus abdominis, which is a separation of those abdominal muscles. It does protect your pelvic floor a little bit. You're not as great of a risk of having pelvic organ prolapse.
I figured that.
But you can still have leakage postpartum with a C-section, and
Oh.
you can still have prolapse symptoms.
Oh, interesting.
So we definitely need to rehab after a C-section. And the biggest things, when they cut through the abdomen and get to that uterus to open it up for baby, the fascia is being affected. So we have to work on core strengthening. We have to work on breathing mechanics again in that rib cage. Scar mobility over that C-section scar, and then still pelvic floor coordination. You just carried a baby 9-10 months.
Ooh, yeah.
There's been that pressure down on those muscles. We still got to coordinate all of it.
Yeah.
So C-section does not exempt you from
It doesn't
pelvic
rule
floor.
you out.
No
Correct.
way.
All right. I like this.
Yeah.
Oh, well, I don't know what this is. You should just push harder when constipated. That may not be a great idea.
So many people deal with constipation, and they just take it as part of their daily life, and they live with it forever. And
Bear down.
yes, just push harder, hold your breath, strain. Okay, constipation is not normal. It's a sign that your gut is not functioning well. Your pelvic floor is not going to be functioning well with constipation. And if we are straining and just pushing harder, it's going to make hemorrhoids worse, prolapse worse, can cause pelvic pain, and it can also contribute to bladder leakage or urgency. So constipation needs to be addressed. I like this. Pooping should not feel like a workout.
Absolutely.
You should be able to sit down, have an easy bowel movement. You're not having to push and strain and use your muscles. And then if you are dealing with constipation and you've tried squatty potties, you've tried improving your water intake, you've tried adding in some fiber,
Yeah.
and you're still having issues, definitely reach out to us. A lot of people with constipation have pelvic floor dyssynergia, where the muscles are actually not working properly and they're wanting to tighten versus opening when pooping.
Okay.
Wow.
Yes.
Number
Lot to-
8. Pelvic PT. Tell me a little bit about that.
So a lot of people just think, okay, what is pelvic floor physical therapy? It must just be like an internal exam. You're just looking at those muscles. I'm going to get a sheet of exercises to do after that first visit, and then I go home and I can do all this, and I'm going to be better.
It'll be all done.
No, we tell patients when they call us and they're like, I just want a one-time visit.
Oh,
We
that ain't
literally
happening.
say, save your money. you're not going to get better in one visit. If that's all you want to do, coming in for a one-time visit is a waste of your money because
Yeah.
you're not going to get better. We have to continue to progress everything. So we're looking at your breathing mechanics, your core and your posture, your hip strength, your back mobility, so many different things. And of course, we are doing a pelvic exam, external, and if people are okay with it, an internal. We're looking at your nervous system. How is your anxiety? How is your body responding? Because when we're more nervous or more stressed or more anxiety, our body wants to tense up and guard more. And we do a lot of education and lifestyle changes, a lot of handouts we're giving patients, making small changes each week when you come in. And honestly, most of what people do when they come into our clinic is fully clothed.
Yeah.
So,
Interesting.
Okay.
and if people have a history of trauma or fear and anxiety, we listen to them and we slowly progress what we're doing.
Awesome.
So it's for everybody.
Good technique.
Absolutely. Number 9. This is very interesting. I'm just going to stop exercising.
Yep, it's
Forget
over.
about it.
Oh, we have people that do that. We
Oh,
have people
yeah.
that call us. They're like, I haven't exercised in a long time because of urinary leakage, urgency, or smearing or pooping their pants.
Yeah.
So they completely stop exercising. They stop going to the gym because either of a leakage issue or even a hip pain or back pain issue. So we want people to we want to help them get to the root cause so they can get back to all types of exercise without leakage, without urgency, without pain.
All
So-
right. That's a great one. Yeah. There's a chance there. Wow, we're down to number 10. The last myth.
We're gonna
Probably
make it.
probably not the last myths about this.
Oh, I could talk on hours.
I know
with
you
guys.
could. We don't have time for
The
that.
book is coming out next year.
That's right.
Yeah.
Hit me with number 10.
Number 10 is that pelvic PT is only for women.
Yeah, that's
We
all I
have-
heard.
yep.
That's just women. Everybody else, forget it.
We have men that call and they're like, I don't know, like I saw on your website that you guys see men, but do other men actually come to you guys? Do they have issues? Yes, men, you are not alone. We just had a couple men in this morning in the clinic.
Oh, good deal.
So men experience pelvic pain. Men have prostate issues, and then sometimes with prostate cancer, if they are having
Mhm.
surgery and treatment for that, with prostate cancer, pelvic PT is a must. Not all doctors are telling their patients that, but if you have prostate surgery coming up, a prostatectomy, you need to be doing at least 2 to 3 visits prior to surgery, and then you're going to need around 5 to 10 visits post to fully recover. And this can help with erectile dysfunction, urinary leakage issues, urgency. Men have the same pelvic floor muscles; they're just arranged a little bit differently.
Gotcha. All right.
Okay,
Yep.
All right.
Man, we've
Yeah.
learned a lot today.
Man.
We've learned. What if we have some of these and we don't believe at it? Dr. April Red, she's full of it. I want to see her face to face. How do they get in touch with you?
Yeah, so call our clinic. Our number is 217-705-5077. We can help with any of those issues we talked about today on the phone. And our patient care coordinator up front, her name's April as well. She can go through more info with you guys, give you all the details. But if you're having any of those symptoms, I definitely recommend getting scheduled. We do 2-hour evaluations because it's full in depth. We get to, we put it all together. We put the full picture together of what's causing the issues.
Awesome stuff. You can go to our Facebook live video here. Click on your Facebook page and find out all kinds of information that way as well.
Yes, and we have a couple upcoming classes.
Yes.
Go to our Facebook page under our events. You can see those. Next Tuesday, we have our postpartum class at the clinic. It's $25. We're also offering virtual for that. And then we have a breastfeeding and pumping class coming up on the 24th at our clinic, as well as our hot, always sells out menopause class. That is going to be March 16th in person. And we are also adding virtual for people who cannot come in
that's
person
great.
that evening and out of town.
I
So
like it.
So get signed up for those and help get your healthier body for you. How about that?
yes,
All
thank you
right,
guys for myth
let's do
busting
it.
with me.
All right. Anytime. All right. We love myth busting. That's good stuff. Hey, we'll talk to you again soon and keep doing the good work, okay?
Thank you.
BD, talk to you later.